Today I have with me a special guest, Etienne Peirsman. He is a respected teacher in the field of CranioSacral. He came to Cranio in a very non-traditional way. After a staph infection left him with nearly 20% kidney function, he found that preparing to die brought him to clarity of total silence. In a remarkable turn of events, he was able to heal his own body, and this led him to travel to Osho International Meditation Center, where he was first introduced to Cranio during an immersive meditation and body working training. From this time, Cranio became his life's passion. Etienne is the founder of Peirsman Carnio, as well as the CranioSacral Therapy Academy in Holland, where he originated the CranioSacral professional organization and is an honorary member of the Dutch CranioSacral Practitioner Society. He produced his first ever online cranio class, which emphasizes stem cells and their superstar capabilities. The midline as a source of clarity and easy ways to reach a no-mind state. Etienne's first book, CranioSacral Therapy for Babies and Small Children, was published by Penguin Random House, and he is about to publish his second book, Tantric Aspects of CranioSacral. Welcome to the show.
Thank you. Thank you for inviting me. Yes.
Absolutely. I don't know a whole lot about this topic, so I'm really excited to learn more and to dive in. So first of all, can you tell us what is craniosacral therapy and why is it called cranio?
Well, cranio comes from the word cranium, is skull. Sacral is the sacrum, which is at the back of your spine, at the bottom of your spine. And in between the two, of course, in your cranium is your brain. And then in the spine is the extension of your brain, the spinal cord, and that ends in the sacrum. So your whole nervous system is in that craniosacral system, we call it, which is basically, it sits inside of your brain, inside of the spinal column, and then ends in your sacrum. So what we do is basically relax the body in such a way that that system that sits in your spine and your cranium has maximum space to do its work. And since the brain and spinal cord and your nerves are controlling the whole body, when they are relaxed, of course, the body will follow and will also be as easy and relaxed to do its work as possible. So that's what we do. Yeah, we play with the brain, we play with the nerves, we play with the spine and the sacrum. And it is a very easy way, very easy to do that.
I want to, it's so interesting to me. I want to back up a little bit.
Yeah.
You had this health problem, kidney function down to 20%, which is extremely low. What happened? You went into a state where you quieted your mind, your body. How did that lead you to craniosacral therapy?
Before that infection, and it was not just the kidneys, the staphylococcus bacteria is quite hungry. You know, they were in my body looking for food. And all right, so the first thing that happened was they ate away all the valves in my heart. So that leaves a heart with no direction to pump the blood. And then, you know, one kidney was, as you say, the totality was almost no kidney function. One was even close to 90% dead material, the other close to 70. So that combination and the heart problem was a death sentence. You can't live like that. And of course, panic. What else are you going to do when you're 40 years old and your life is over? You're going to panic. Luckily, I had about 10, 15 years of meditation under my belt and all kinds of therapy that were available in those days. So yeah, when panic doesn't work, and of course it doesn't work, it doesn't change anything. So, as a last resort, I started to meditate, and this was one meditation that I did. It lasts about an hour, and in the middle of it, yeah, it clicked, because basically I was at the end of it. So there was no choice for me than either to stay panicky, and somehow I reached no mind in that moment. In the middle of the meditation, suddenly my brain just went blank. And when a brain goes blank, in this case, what happened was I felt myself to be in total bliss. There was no panic anymore, no fear, no anxiety, nothing, no fear of dying, and not even that was present. Whether I would die or not, it didn't matter. I was in a totally different space. And that was amazing. That was amazing to be in that space. And it lasted almost 2 years that I stayed in that space. And later I needed my mind back to function in the world. But, before that, so when I went into that space, of course, it didn't change the valves of my heart or the kidney. They were still ruined. And so I went, they took me to the hospital, some friends. They couldn't do anything for me. They couldn't, they had no clue about stem cells. This was in the 1980s. It's quite a while ago that that happened. So nobody had any clue how to deal with me except give me painkillers or whatever they were giving me and medication. So that I was blown up with water because of, yeah, my kidneys didn't work.
Right.
So they helped my kidneys to function. But those medications were so painful that, yeah, it was horrible. But anyway, that was a side thing. That pain was there, and I didn't really, it didn't really affect me. But all right, what happened was that, yeah, in the hospital, I died, literally. And in the middle of the dying process, and that was the amazing thing because I was in that no mind space. I didn't panic. I didn't care actually whether I would live or die. It was just a happening. And I was able to watch that, to just stay conscious and see the process that my body went through when it was deconstructing itself, basically. And later, I found the same thing back in the Tibetan Book of the Dead. They describe exactly what I was going through. I didn't know that at that time, but I could watch that happening. And then at a certain point, yeah, hey, the body goes through these stages, and the last stage is you explode, literally. And I felt myself exploding, and that was so beautiful. I felt myself literally exploding in millions of light points, like I became the Milky Way. It was like that, it was these, yeah, like in a sci-fi movie, where everything goes.
Mm.
It was just amazing. And I was like watching a movie, but the movie was about my own body doing that. And it was just, yeah, like watching a movie. And in that explosion, there was a person next to me. Yeah, I forgot to say. I was in a room, I was 40, and I was in a room with six other people that were 80, 90, all ready to die, all waiting to die. And one night, everybody was going through a dying process, like one, two, three, four. I was number five, so I saw four people die, and then it was my turn. And the person next to me was after me, so it was like, okay, one, like we had numbers. And when I was going through that process, there were already four dead people there. And then something happened to the guy on my left, something with his heart. And that was so strange. As soon as I felt that, I was back in my body. That whole process of explosion was interrupted and I was back in my body. And the first thing I felt was I didn't fit anymore in the body. It was like I was, yeah, the body was a bit too small to contain me. But anyway, that was what happened. Then I turned around and put my hand on his chest because there was something, some emotion that he couldn't let go of. And then another crazy thing happened. You remember the movie The Matrix, probably, where
Mm-hmm.
the lead guy puts his hand in somebody's chest to pull out a bullet? That happened. I put my hand on the guy's chest and I saw my hand disappear in his chest. Now, this is impossible. Yeah, that cannot happen. But since I was still in that crazy space, yeah, of where I had been, the explosion, I saw that happen. And something, I touched his heart and something happened to him and he didn't die. And I was back, but still in a body that couldn't function. So that was weird. But still, there was this peaceful space of total no mind. So, to continue with that story, I stayed a few days more in the hospital and they gave me so much medication that I knew the medication was going to kill me. And it's strange, but
Mm-hmm.
that's what I felt. So I thought, I talked to the doctor, the kidney specialist. I'm out of here. So I had to sign papers, release papers. And then a friend of me drove me for half a day. This was in the Netherlands, in Europe. And he drove me to the woods in Belgium, in the south of Belgium. There is still nice woods, not a lot of people. So we arrived there in the middle of it was already dark. It was in the summer, luckily. And we had no clue. I had no clue where to go, but I was guiding him there and there and there and there, and I had no clue. And finally, we ended up in a dead end. We couldn't go any further, and I knew this was the place to be. I didn't know what for. But anyway, he put up a tent to sleep, and I couldn't be there in that place in the tent. So I left and started walking in the woods. And suddenly I saw a clearing and some trees. And it was in the middle of nowhere. There was no electricity, no houses, nothing, just trees, pine trees. And in that clearing, the trees were giving light. That was amazing. It was as if there was a light in there. And it attracted me, of course. And, it was like a calling. That place was calling me. So I went there and I laid down and went to sleep. And immediately I left my body. I could see my body from above. I was out of it and just saw the body. And it was so nice. There were pine needles, a thick carpet of pine needles, very soft. And then all these little animals came by to look at what is happening there. Little foxes and snakes and rodents and a boar with maybe 12 or 15 small little boars, all sniffing, all curious. And what I was just hovering above, looking at it. And what really was amazing was the respect they had. Nobody touched me. They were just as if they knew what was happening. I had no clue, but as if they knew that something magical was happening to that body that was lying there. So this lasted the whole night, and in the morning, the sun came up, and that made me, the heat of the sun made me able to get back in the body. And this lasted for 4 days and 4 nights. In the day, I just sat there, meditating, or however you want to call it. And then at night, the same thing happened over and over again. And after 4 days, I told my friend, all right, I'm good, let's go. And a few days later, I went to the hospital just to see what had happened. And my heart was 100% back to normal, and my
Oh,
kidneys also. And now, this was in the 1980s. My heart is still functioning. My kidneys also, they're really great. So, yeah, something magical happened there. And, that quietness, that peace of mind, I found that a year later when I was doing a meditation, actually a massage training, a deep tissue training in India. And there was a little piece, a 4 day piece of craniosacral. And as soon as I felt what craniosacral did, I knew I'm going to do this for the rest of my life, because the quietness, the peace, the respect, everything that happened during my death experience, that peace of mind in Cranio, it is so easy to replicate that, to just put your hands on a person and your mind just stops functioning. And then you're in that place where knowing, you just know. It's the same space that a baby goes through when it's developing. How does that happen? How does a baby create itself? There is just this knowing in the cells how to do that. And the same thing also happens every night when you go to sleep. Your body needs to restore, and your body, even your brain, needs to be cleaned. So your brain stops functioning because, hey, if it functions, you can't clean it like a motor, an engine. You have to cut the engine, cut the electricity, and then you can clean the motor. And for the body also. So that that no mind space at night, it's the same space that we go into Cranio. And it's so easy. That is the nice thing. It's so easy to go there and to explore that. That's a nutshell. The story.
that's quite a story. So many
It
things were
is,
going through
yeah.
my
That's a
mind,
nice story.
though, as you described that place of quietness where you could heal. Because I was thinking about how we are in the States, and we're always running, running, going, going.
Oh,
Stress is constant. It's,
yeah,
you're driving to work, or you're dealing with a boss or family. It's an ongoing thing. I don't think
yeah,
we carve out any time for this state of no mind, the state of quiet.
yeah. There is no time, and it's part of, what how we made our life to be. Yeah, that competition in society, and it starts in school, where kids are really driven, and it's tragic, but every school, every kid is driven to learn exactly the same things. Even if you're not interested, you have to learn everything they give you. And of course, most kids are not interested. So there is this getting away from your natural, what you naturally want to do. And then the competition in school, and it's never enough. You have to get another diploma and another diploma. And if you go to work, then you need to buy a second car and a vacation home. And we have a very strange society. Where relaxing is not really part of our education. I don't remember learning how to relax in my education.
Oh no, that was never a part of mine either.
No,
So when a therapist is working with an individual doing this type of therapy, this craniosacral therapy, what exactly are they doing, if that makes sense? What is, I know because
Okay.
I've had it done on me like on a massage table, so I know how I feel in that state. But what
Yeah.
exactly is the individual working on you or doing the therapy? What process are they going through?
Yes, well, let me first say it happens fully clothed. You don't have to, some people think, oh, yeah, no, no, you keep your clothes on, it's very, yeah, very safe, I would say. And then what we do, we use a few, well, you could say scientific tricks. Yeah, the first thing that will happen is we do something like conscious touch, which is different than massage. With massage, you move, and of course, massage is great. But what we do is we just touch, and then we give ourselves time to feel, literally feel, okay, if you touch before you start moving. Yeah, and that's also something that in our society is part of what we do. We need to do something. Here, you just touch and you wait, and you become conscious. We call it conscious touch of what the hand is touching. What is the pinky touching, and this finger, and this finger, and this one, and this one, and the whole hand. So you get in a state of instant mindfulness. You don't have to do anything because you just focused. What is it you're feeling? And if you're 100% there, your mind shuts down automatically. Another trick we use is we relax the jaw, which will switch. If your jaw is tight, yeah, all these muscles work, and they, although it's just a little tension, but they make the brain create little amounts of stress hormone. And then you start thinking about what is going on. So just relaxing the jaw, again, it's a signal for the brain to boop, stop functioning. And then maybe the most important thing, when you touch like this for about a minute, your body and also the client's body, it's both. That's also one of the magical things in Cranio. It's not only beneficial for the person on the table, but the person giving it goes through the same feelings. The two bodies go through the same things. So after a minute, both bodies starts producing oxytocin. Now, that is a wondrous chemical, a wondrous hormone in the body. It's what mom and baby produce. It's what creates love between the two, meaning one, they remain one. If oxytocin is not produced at birth, and this is a strange thing, but mom cannot love the baby if that is not happening. If a baby is taken away, and for more than a few minutes, like an hour or a day or 30 days sometimes, there is no bonding that happens. Oxytocin has that effect of creating oneness, or another word, you could say, what is oneness? It's another word for love. Yes, so when we touch that way, there is this unity that happens between two bodies, meaning also that the person on the table also has an ability, or two energies become one. It's not just the person's energy, like in deep sleep, you heal with only your energy. But if you touch this way, the two energies, the two amounts of energies are available for the client. So healing becomes so magnified. Yes, so that's our way of touch. And then we know in every body there are the same doors that are closed. We call them diaphragms. Yeah, and they're with everybody exactly the same. One of them is right under your chest, where the ribs end the respiratory diaphragm. And most people hold their breath. It's again something we learn at school. You have to be quiet. At home, sometimes also, you have to be quiet. So you can be quiet, so you get punished. And after a few times punished, you learn to be at school means you have to hold your energy in. You have to close that diaphragm. And there is so a few places, like five of them in the spine, that we know need to be opened. And that means that if you open those doors, your life force can circulate much easier. And then we go to the skull, and there is, yeah, different bones, and they all articulate with each other. They're very tiny joints between them. We call them sutures. So every bone in your brain has a rhythmic motion. It's very subtle, but yeah, everybody can feel that. It's just a matter of tuning into that. And then we just allow these bones because, yeah, if you feel them, they will show you where they're stuck. It's so easy, actually. They show you where they're stuck, and then we just stay there until they release. And they do that because they would have done that on their own, but they couldn't. So if you add your energy to that, now suddenly there is enough energy in the body to pump and pump and pump and pump. Yeah, one after the other, they go to the best spot at this moment. And then, of course, your brain is going to be happy because all the bones now are a little bit better positioned. So now the brain can create or find. Suddenly, there is more space for the brain. And that's so nice for a brain to really, really find, hey, yeah, space it didn't know before. So, yeah, that's in a nutshell what we do.
Now, when a client is coming for this therapy, what generally are they dealing with? Are they coming for uh, purposes of relaxation, quieting the mind? Is it physical ailments, pain? What do you
Well,
generally
yes,
see?
yeah, there is a few categories of people that come, and mostly they come for relaxation, of course. Yeah, for learning what it is to relax again. And when that happens, and there is one thing that I forgot to mention with how we work. There is this thing that we call the midline, and that's a defining factor when a baby is growing. In the beginning, before there are cells like skin cells or nose cells or eye cells, everything when a baby starts with his growth, it's a whole bunch of stem cells. And stem cells, they have, they're like drops of water. They don't have a form just to drop, but they can change into whatever they need to change into in the body. And they will expand to such an amount that there is enough to create the whole body. And then when that happens, they're in like in a pancake form. And then in the middle of the pancake, suddenly a line appears. It's very simple, just boom, a line. Now, if the line doesn't come, those cells anyway start creating. That's what they do. They use the life force to start creating. But if the midline, we call it the midline, doesn't appear, they will create, but chaos. And not a body, but just, yeah, a ball with all kinds of cells, and that's dangerous. So if that happens, they will remove it surgically because, yeah, there is something in the body that cannot be alive. But when the midline appears, suddenly every cell knows what it's going to become. They suddenly know their purpose. All right, this cell knows I will be part of the eye, or the nose, or the muscle, or the heart, or the brain. And secondly, they also suddenly realize, oh, if I want to be part of a kneecap, I have to move there. So now all these cells suddenly have clarity about their purpose and their place where they need to be. And also when they need to move. They can't move all at once. Yeah, it's a real defined order. So that midline is something that at that moment when that happens, there is no brain yet. The brain still needs to be formed. So there cannot be any thinking also because, hey, to think you need a brain to do that. So when that happens, these stem cells know what to do because of the midline, they know exactly what to do. Now, if we go into that no mind space, we have, and that's a funny thing, strange also, but we have access to that intelligence of the midline again. And that midline is all about clarity. So that means when we work with the client, and that's our training, to connect again and again to that midline. So when we work with the client, what does the midline bring? Clarity for the cells. So there is a physical realignment, but also every emotional aspect that the client has that's in the way of clarity, the midline will push it to the surface. So clients connect to whatever emotional state that is in the way for them to function the way they could function. But also any mental thing that's in the way for them to function clear with clarity also will come to the surface. So, besides the physical aspect of realigning a body and skull bones, we also, and one of our classes is it's called talking to the heart, where you literally, and this is one of the amazing things, we ask our client to lend their voice to their heart. So then they can talk to the heart directly. So that is quite amazing. You know, I can ask you, how is your heart feeling? Does your heart have anything to tell you, Carol? Sure, it has, but your answer will come from your mind when I ask that. But if you're in that no mind space and your brain, your mind is on pilot flame, you're laying there and you connect to your heart, the answer will be real. It's not your mind coming up with something, but now it's really your heart that can talk to you. And we can do that with every organ. It's one of the techniques that, yeah, we developed to to connect to what's in the way or to unclarity about a person's life. So yeah, people come not just for physical relaxation and realignment, but also to, yeah, look at their emotion, look at their anxiety. What is the reason that they're so anxious? And what organ cannot relax? And then we can just ask the organ, hey, liver, what's up? Why can't you relax? Oh, yeah, I'm angry at this or that. You know, this emotion comes up, and yeah, we can deal with it then without, that's a nice thing, without going into the story, without going into the story of the trauma. We don't have to do that. Well, maybe a little bit, but not like psychotherapy where you for months talk about the story. No, this is very dosed.
Yeah, I can see where that would be re-traumatizing to ask
Oh,
somebody
yeah.
to go through a story
Oh,
repeatedly. Now,
oh,
I could definitely see that happening because I think there's a point where it's just overwhelming for us, for our body, for our
yes.
mind, to
Yeah.
revisit and replay a trauma over and over
Yes.
again.
Yes. In the beginning, that was, what I was doing. And then I realized, hey, this doesn't work. This doesn't work at all. So I had to really change my idea about how to work with it. And one of the things that we do is with trauma, instead of going into the story, we now know where the story is stored in the brain. It's like a computer, the brain, or yeah, with different places where different files are stored. And of course, you can go into what is stored there, the trauma, the story, the history, or it's an electric system, the brain. Or you can go to the places and let the electricity, the static electricity out. And that static electricity is part of the story, it's part of the looping. If the story can't get out, it keeps on going. So if you let that electricity out, zoom, then the story becomes something that's not scary anymore. It's first you let the excess electricity out, and then you have access in an easy way to whatever still needs to be said to get clarity about what happened really.
I think we can get stuck on a story too, not just a trauma story, but then also something happens that's traumatic. So then our brain creates this, like you said, this loop. And
Yeah,
it's a lot of times with myself, I've looked at things that are being played in my head and asked myself, is that really true? It's usually a negative thought about myself. Like for the longest time, because of something that happened way back in my past as a child, I would tell
yeah,
myself, you're not smart enough. You're not smart enough. And I walked around with this looping story going around forever until I challenged that. And so I can
yeah.
see where that no mind state of clearing would be helpful with that.
Absolutely. Yeah. And there is so many things that we tell ourselves or that other people tell ourselves, and we start believing it. Yeah. And then at a certain point, you realize, hey, is it true? Of course not. Of course not. Everybody is born brilliant. Yeah, it's not, yeah. If we give the same education to everybody, nobody can find their specific thing. Yeah, that I can talk hours about that. Yeah, it's so annoying. Yeah, I remember my own time in school. Maybe if I would cut it down to what was interesting was maybe 1 hour in a whole year or 2 hours or maybe a day in a whole year of schooling. And then you sit there bored, 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 yeah. And you lose your own value actually, your own brilliance.
Yes, because if you're not able to gravitate toward the things that we all have natural gifts and talents, I believe,
Yes,
and we're not
yes.
we're not all going to go the same direction. Some are going to be fascinated like my dad was with mathematics. He was fascinated
Mm,
with mathematics. I was not. I
really?
loved words and reading and writing, and we're not able to gravitate toward what we really have a passion about.
Yeah, it's sad.
Now, do you work with many children, or do parents bring in children where they maybe a child is having, say, because as my daughter had ADHD growing up, pretty severe. Do you see these types of circumstances as well?
Oh yeah, oh yeah, oh yeah. There is these things that we can do with the brain, which is so simple. It's not just working with bones. The brain has emotion. It's very subtle, but the brain, moves a little bit just like your heart beats and your lungs move. Your liver moves, your stomach moves, your kidneys move, all minimal. But you know, we're at the time that we discovered that everything moves. And with the brain, you know, it is a very subtle motion that the brain goes through. And what I noticed, and this is something that I do, used to do, I now only teach, but I used to have a practice for more than 30 years. And that's also where that baby book came from pictures that I took that were taken from with me treating babies and small children. And yeah, and one of the things we do is just feel the brain and feel its development. And very strangely, sometimes a brain needs to move. It has a natural motion, very slow, very minimal. But yeah, that's what we learned, to be that subtle. And then you feel that a brain, it needs to be equal left and right. And also, when a brain moves, there is moments that it just stops, that there is no motion. And every stop means something happened. And it couldn't get rid of the toxins at that moment. This is very subtle, but cells, when they work, they produce their own energy, so they also produce their own toxins. And if there is any stress, a cell cannot release those toxins. So when there is a still point, when everything stops, for us, we know, all right, cells are releasing toxins. And then after a while, it keeps moving, again a stop, and again a stop. So the brain is releasing the toxins that were still in there. So that's one aspect. But usually, one part of the brain is overdeveloped and the other part isn't working at all. And it feels strange, but it feels almost, when it's a real big thing, as if that part of the brain is just a drawing. Not a house, but an architect makes a drawing, but that's not the house. The house is a thing, and a drawing is something else. And sometimes the brain, half of it feels like it doesn't get any energy. It is, yeah, the other part takes too much. So what we do is we wait for that energy in both halves to become one energy. Yeah, that they're even, left and right brain, that they're just even. And at the same time, we give the brain a chance to release all these toxins that gathered and became more and more and more during, yeah, going to school. So that's one of the things. And I would advise you know, your daughter to, yeah, to go with your daughter to a craniosacral therapist and let them work with her brain to see what happens, because HD, ADHD, you know, it's not something that's gonna last. And with medication, you know, you need to go and look, okay, why is that brain doing what it did? Why can't it relax? And with Cranio, we can do that.
You know, she actually did see somebody when she was very, very young because she was going through some difficulties with
Yeah.
learning to walk, learning to speak. That was delayed. And so we actually did see a neuropsychologist here in Albuquerque, forget his name, that was referred to us. And that was the method he was using. I just didn't understand it at the time. And I
Did it help?
remember it did help. It did help. You know, my children are all adopted from China. My husband and I made three separate trips there. So he actually believed that there was something she went through during and I'd heard this from a pediatrician as well. She
Of
was
course,
premature. Yeah, the whole
of
birth
course.
process being somewhat traumatic. And so that's what he told me. But like I said, I didn't fully understand it because it wasn't explained to me the way you've explained it, you know, here on the
Yeah,
show.
okay. You know, there is if it's still needed, there is a woman, Rose. I forgot her last name, but you can find her probably on our website. Um, who knows how to work with brains and who will explain also, not keep it a secret, but she will explain what's happening. And I think that's very needed, that you understand what is being done. I think that's very needed. But anyway, if your child is better, that's good.
Yeah, they're all grown up now. She's doing
Oh,
she's
okay.
doing well. She's doing well. They're all in their 20s now. But
All
yeah, this
right,
was a
great.
very long time ago, and I remember being told, okay, he's a little bit different as a psychologist, but he's helped a lot of these kids. And
All
and
right,
so we
good,
did do
good.
that. It's just I just didn't understand it to the full extent.
Yeah,
Now now if somebody is okay, a therapist is working on them because this occurred to me. What if they don't go to that no mind state and their mind just keeps racing? Does that happen with
we
people?
have methods to take them there. It's so typical that somebody is so wound up and their bucket is just full. Yeah, they can't hear anything. They can't let anything in. They're just beyond already. So we have a method which is very simple. We let them do something. They go on the table and we call this fireballs. Yeah, and it's an exercise. We ask them, it's very simple actually. They're on the table and all agitated. So one of the things, it's a whole bunch of different exercises. It's like gymnastics. Yeah, we ask them to tense up their shoulders and their fists and then throw out fireballs as if they've, like in a cartoon, they throw fireballs out of their hands and they make a short sound, like karate sound. Yeah. And, when they do that 3 times, and then with their legs, and then with their body, the whole body, it takes 10 minutes, but then they're sweating. And then they're happy because, hey, they did something. They were allowed to scream, just short, but as loud as possible. They were allowed to be as tense as possible. So we empty their bucket a little bit. And then, yeah, we go into different parts of the brain, releasing energy. And it works like a charm. It works like a charm. Yeah, because people, they need to physically release, when they're so anxious, what is actually happening in the body is every time you want to do something, you want to, but you're not allowed. You create hormones to do something, but if you're not allowed, the hormones stay in the body. There's hormones to move the body and to talk or to scream or to run or to jump or whatever. But if you're not allowed, they stay. Now, in school, this happens thousands of times. As a kid, you want this, you want that, but you're not allowed. And if you do, you get punished. So you're full of stress hormones actually if you come out of school, but you have no clue because you're used to that by that time. But with that exercise, you burn up a whole bunch of those hormones, which means they're not so pressing anymore. And the client becomes a bit calmer and satisfied and sweaty, and because it's fun. They start smiling also because it was a fun thing to do. And then you can, yeah, do stuff with them because then they can accept it.
Mm, that makes so much sense to me. I used to teach grade school. Well, I taught middle school and grade school. And I had first graders teaching them to read
Oh,
and
that,
write and do the math. But the way that my method was I used a lot of movement. And so we
oh,
had
yeah,
so many games for learning the sounds of the alphabet. We had games for mathematical equations. They were up, they were down, they were standing up a lot. And you're right about that. If I would give them that amount of time to move
sure.
and be an active learner, then they would settle down when it was time to settle
Yeah,
down and do a more detailed task, pen to
yeah.
paper. So that makes
And
sense to me.
then they would get it also, right?
Yes. Yes, they learned quickly that way.
Oh,
And
yeah.
that's how I learned. So that's why I used it. When I'm reading for a test or something, I'm working on my certification right now in functional medicine, and I will carry a book and walk and
Yes,
read,
yes,
because
that's the way to learn. Yeah,
I can't
great.
just sit. If I start sitting, I start fidgeting, thinking about all of my to-do list, everything but the
You
book
know,
I'm supposed to be reading.
I used to be a gym teacher also in primary school,
Hmm.
and what I would do with the kids, those first graders, they would come in the gym class and they would look around and what to do. I would close the door and I said two things. All right, before you go, one thing I'm gonna ask you is run all around as much as you can. Oh, wait, not yet, not yet. And second thing, scream. So if I let them do that for 5 minutes, run and scream. And then after 5 minutes, they were so happy. And then I could teach them all kind of stuff, because hey, yeah, most of the energy was out now, and now they could listen. And of course, the headmaster didn't like that at all that noise.
I bet. I found though allowing that bit of wiggle room for them, it builds trust too. I found they trusted me more if I had these times during the day where I was allowing them
Yes,
to be kids and to
yeah,
learn in a more active way. And it built a lot of trust in the classroom.
yeah,
Well,
exactly.
Etienne, I want to be respectful of your time. This has been so fascinating and interesting. I know the subject, there's so much I could learn going forward, but I wanted to ask you a couple of things. So, first of all, how can listeners connect with you, work with you, learn more about your work? And then
Yeah.
also, is there anything that I didn't ask that you want the listeners to know?
Oh, there is so many things you didn't ask, but way too
I
many.
bet.
And I can go on for hours, but people can look at the website. And there is on the website a basic class where people can sign in and learn, yeah, what we call a basic class. And it's an easy website. It's called CranioRocks, like rock and roll, CranioRocks.com. And then they go automatically to our website and can find a bunch of articles, a bunch of podcasts where I talk about all different subjects about birthing and about lotus birth, about placenta, and so many subjects. Yeah.
Yes,
So
there's so
Cranio
much to
Rocks,
this. Cranial rocks. Okay.
yes,
I'll make sure
CranioRocks.com.
I'll make sure all of
All
that is
right.
in the show notes so that they can connect with you. And as we wrap up, thank you so much for being on the show. I've learned a lot and I just appreciate your time so much.
It was fun. Thank you.
And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.